Thank you very much, Miss Mrs. Sorry, Kamala John Baptist Aaron, my good friend, staff of the Ministry of Honorary Staff of the Ministry of Health. Okay, thank you again, Honorable Minister for Health and Environment. It's very difficult to follow after the minister speak, but I'll try my best. The Permanent Secretary of Health, Mr. Davis later, other heads of department of the Ministry of Health, the press secretary or press advisor, the media houses that are tuning, the public, good morning. I'm pleased to be part of the Honorable Minister of Health team in this official press brief of the Prime Minister's office. This is the second such press brief that I have been invited to be part of. I think I said probably in different terms in the first press briefing, but I will say again, I tell people that Mario was too weak to knock us down and to keep us down. So the health system is recovering and continues to provide continued quality service to the population of Dominica, both at the secondary care level and the primary health care level, which our director will speak to detail to in a moment. And I would like to continue by saying thanks to the leadership of this country, the leadership of the Ministry of Health, the Honorable Minister, the staff, administrative staff of the Ministry of Health, and all of the staff of the Ministry of Health. And when I say staff of the Ministry of Health, I'm referring from, as the Minister indicated, from yardmen to cook to pharmacists, to every single person that is involved, whether directly or indirectly providing health care service or ensuring that health care services provided to the persons of the Ministry of Health. And I'll speak to our volunteers, which I'll speak to a little bit in a moment. And also to the wonderful persons who have been volunteering at the site we have in Newtown, Mr. Errol Thomas and Mr. St. Clair and his team for ensuring that all of the supplies that we get are speedily distributed and efficiently distributed and accounted for where they are stuck at the former primary school at Newtown. At this moment, what I will do is probably just bring you up to speed in terms of what is going on at the Princess Margaret Hospital, but focus to some extent, taking up from where the minister has left off in terms of some of the recovery effort and where we intend to go to speak to some of the specifics. So the hospital, as I said, continues to provide emergency medical service to the population. The Accident and Emergency Department is fully functional at this moment. We operate on, although we have limited staff, but we operate on a flexible shift, sometimes 8 to 12 hour shift is in place for nurses. The Radiology Department of the Princess Margaret Hospital, the services are functional, so we have X-ray, plain X-ray, ultrasound, our CT scan is back and running, fluoroscopy is also functioning. The medical ward, we remember in the first press briefing we had some dislocation of the medical ward, so I'm pleased to report that the male and female wards are separated and housed on original wards. The obstetrics, gynecology and neonatal unit, antenatal, neonatal patients are housed on the antenatal section. We have the operating theater in maternity unit is fully functional. Emergency cesarean sections and normal deliveries are being performed on a daily basis before, during and after hurricane. And the majority of our mothers are postnatal mothers and children. That unit is being renovated, as the minister alluded to. Surgery, unfortunately, only emergency services are being performed at this moment, and we will announce in the near future when elective surgery will resume. All the 3 main operating rooms are are repaired. So we have repaired the main operating room, and they will be due to be commissioned or to reopen very shortly. Male surgical ward has been moved back to the original location. Our ICU, the original location was destroyed, and we are temporarily located in the Winston ward. So we continue to provide intensive care service to the population. Our dialysis, all our machines are functional, and normal dialysis services are ongoing. Oncology, the regular clinics are ongoing. We have some limitations at this moment with regards to the chemotherapy, the drugs that we administer, not in terms of the actual drugs, but where we administer the drugs to our patients. But we are looking at renovating that area and ensure that the chemotherapy continues. Psychiatry, this psychosocial support provided through the psychiatric unit is ongoing, and that is one of our strong points within the Ministry of Health. The team is not here; they're out in the district, and I suppose they will join us shortly. But the psychosocial support, which is absolutely necessary, is ongoing. I should also let you know that to date, the Ministry of Health and Environment continues to benefit from clinical services by several self-sufficient volunteer missions at the Princess Margaret Hospital and the primary health care level. Volunteer teams are mainly deployed based on the assessment of the areas identified for priority areas that we identify as priority areas. And currently there we have 6 volunteer groups, giving a total of 16 volunteers. But to date we saw, from the passage of Hurricane Maria to date, we saw at least a total of 188 volunteers, doctors, nurses, you name it, who came to the island to provide assistance to Dominica, and we want to thank them. Sometimes when you begin to call names, you miss some persons, but I just wanted to mention a few of them, although the minister did so, and I hope I don't miss anyone. We had from the Samaritan Purse, New York City Medics, the Team Rubicon, Massachusetts General Hospital, Harvard University Disaster Response. We had a team from Your Caribbean Nation Medical Mission. They came here twice on island. Hands International, they had several missions. We had the Israeli Aid. Presently, they are providing services in the La Plaine area. Our good friends from Cuba, from Palestine, Venezuela, Barbados, we had Sandy Crest Medical Center, and also the Barbados Defense Force. Martinique, we had Samuel, who was here. Trinidad, we have a team that is presently here and has been here since the passage of Hurricane Maria. Is there not a cause? We have Greenpeace, Pentecostal Assembly of the West Indies, Massey Foundation. We had persons from CAFA, St. Lucia, our sister country, St. Vincent, Jamaica, even from the Jamaica Defense Force, Bahamas. I hope I didn't leave out anyone in the list of persons that we mentioned. And if I do, I'm sure Piano will correct me. But ladies and gentlemen, I just wanted to let you know that Maria has greatly increased the health-related risks, including things like, I said so already, but we want to remind you, acute respiratory conditions, gastroenteritis, due to sometimes poor sanitation and our food safety. We are mindful in terms of our vector-borne diseases outbreaks, including things like mosquito-borne diseases such as dengue, Zika and chikungunya, as well as leptospirosis. And I will speak to some things that we did recently in terms of an assessment of our surveillance system. So we in the Ministry of Health, as I in my initial part of, I indicated that we are recovering nicely, but we are looking in terms of our, as the minister alluded to, has laid out some policy direction for us and the government of Dominica. There's a need to increase. We realize that there's a need for us to increase screening and to be more diligent in the management of chronic diseases. We have begun doing to some extent our self-assessment, and we have to do very shortly what we call a formal assessment of how we did things we did well, things that we didn't do so well, and things we need to improve upon in the Ministry of Health. And after action review, as you call it, we are planning to conduct that very, very shortly. So in the medium term, the minister has indicated that, and we're going to build back, and we're going to build back stronger, and build back a country, a health system that is going to be a model to the world, a climate-resilient health sector, Mr. Minister. That is the directive that the minister and cabinet has given us. So in medium-term to long-term strategy to build resilience in physical infrastructure and health system, making use of affordable technology, health policies or strategies, legislation, as the minister alluded to. We have to, and I'm not speaking a lot about it, but primary healthcare director will speak to it. The primary healthcare system that needs to be revisited. We need to think in terms of from lessons learned from primary healthcare, how we strategize in terms of our 49 primary healthcare. If I left out one or added another one, the director will correct me. But we have learned some lessons that in terms of how our system, our health centers can be cut up, and we have to move forward. Human resource strategy must be reviewed and consideration given to expansion of environmental health services to make use of persons trained. We have conducted, with the assistance of PAHO, we have begun doing some self-assessment, introspection in terms of some things that we did. So we have looked at the overview of our surveillance system. And one of the things that we realize that we need to do in moving forward is to conduct a formal evaluation of a surveillance system. We have a surveillance system that is mainly focusing on communicable disease, and we need to, and we have already begun discussion with our partners, our external partners that give strategic guidance to the Ministry of Health, the Caribbean Public Health Agency, the Pan American Health Organization, and CDMA, it's not CDMA, I'm sorry, CDC, in terms of looking at our surveillance system to ensure that it's more robust. You need a robust surveillance system for data so that we can take proper decision. When the minister asks for information, or the prime minister, we need to be able to provide that information on a timely basis. So those are some of the things that Maria has taught us in terms of going forward. We need to review and revise conditions on syndromes being tracked, as I said, on a surveillance system. One of the things that we realize, and we, as I said, I'm looking in terms of going forward, in addition to what the policy direction the minister has given us, is perform a health emergency simulation exercise activity. Although the health sector, we realize, and probably we not blow old trumpet, I think we're fairly organized and structured in terms of our health. In terms of our health emergency operating center, but there's some lessons learned in there, and we realize that we need to move ahead and conduct a simulation exercise. We need to plan and ensure that we have more in terms of our reporting system, electronic reporting system. I know persons might question it. Paper-based, we're not going to get rid of paper-based, but we need to strengthen our electronic reporting system. And very importantly, provide periodic training and refresher training, monitoring and evaluation for our staff. So at this point, one of the things that we have done is even to look at, in collaboration with the Pan American Health Organization, as I said, our partners that are here for us, to look at even starting to put together a work plan. So we have looked at recovery, but we're looking at moving forward. Mary has taught us a lot of lessons. So we're looking at doing a complete laboratory capacity assessment. Our laboratory was affected in terms of its operation. Our laboratory service is back up and running. Is back up and running, but we're looking at from the lessons learned to ensure that we do a complete laboratory capacity assessment. We need to standardize in terms of our monthly reporting submissions. Data is important, information is important for decision making. We need to look more carefully in terms of, or we have begun looking more carefully in terms of how we review our acute respiratory surveillance system. So in a nutshell, I hope that was a big nutshell or small nutshell. Following, I should end by telling you this: that following the passage of David some decades ago, Dominica developed a primary healthcare system which was a model to the world. Mary has come now, and as a minister, and the government has given the direction to ensure that we develop a resilient system, a climate resilient health sector. So that's what we're looking at. And so given this new normal of climate change, we're going to focus in terms of moving forward 6 things to strengthen our health system. In terms of our service delivery, we have to, our service delivery to our population, to make it more resilient, to ensure that we continue service to our population in spite of whatever strength hurricane that we have, and we are going to continue to have them. We need to strengthen our health workforce, our health information system, number 3. Our access to essential medicines, very, very critical. We need to ensure that we have medicines available on a timely basis for our population in spite of whatever disaster can. 5th, healthcare financing. The minister has already alluded to that. We need to ensure, as a direct policy direction given, our healthcare financing is robust. And the 6th pillar of where we are looking at in moving forward is our leadership and governance of the healthcare system. Without leadership, without governance, without legislation and strong persons to guide the sector, it means that all of those things can come through. And very importantly, the 7th pillar in terms of our where we are looking to move to build a climate resilient health system is to ensure that we have good and strong community participation. So in ending, what I can say to you is that we are building back. We are building back better, and we're building back stronger. And the mandate that we have as policy advisors getting from the policymakers is that we and Dominica, and all of us who are sitting here in this room are going to be part of that process. We are certainly going to be part of that process. Dominica, and this is the announcement that the minister has given and the government has given, and we need to implement it, that Dominica will be the first climate resilient health system in the world. I repeat, this small country of 70,000 persons, we had a primary healthcare system that's a model to the world. Dominica is going to be the first country in the world to develop a climate resilient health system in the world. Thank you very much.